Right, Paul, shall we, we'll just run through this presentation that we've done. Is that okay?
I think that's a great idea to go through what we presented in Norway at the conference. Yeah.
Yeah. So this is what we spoke about at the MHPC 22 conference in Oslo last month. And so other people can watch the video and listen to the talk. So essentially, we introduced ourselves, didn't we? And so basically, I can introduce myself now, and you can introduce yourself now. So I'm a hand surgeon, London, 25 years working mostly in the NHS, and now the last 6 years have been private only. I'm a keen amateur trumpet player, and I inherited this huge musician's hand practice off Ian Winsper and John White a few years ago, and I've really enjoyed doing it. And you?
Yeah, so I am Paul Anders Søgaard. I'm a guitarist based in Guildford, the UK, and I'm a performing arts coach and executive functioning coach. And I have been working with guitarists for 20 years, helping them rehabilitating their technique. And I also have a background in psychology, which also plays a large part of my work with guitarists.
Cool. Right. So this is what we went on to talk about. So so how did we get to this point where we had a partnership working together? And actually, interestingly, Paul, what we discovered when we were there, that we were the only people in Europe that really did anything like this. And when I did a similar thing with Penelope Roskell about the piano in the American Performance Arts Association, it seemed the case there. So people aren't doing this collaboration between hand surgeons and technique pedagogues around the world. It's an extraordinary thing. And so one of the reasons that we went and did this was because we wanted to find out whether anybody else was doing this, and we could talk to them about their experience. But we were thrown together, weren't we, Paul, when we largely at the beginning of lockdown. I'd been sending you patients before that as face-to-face people, and then in lockdown we got to know each other a lot better because it was easier for you being in Guildford and me being in London to speak to each other on Zoom and discuss cases, and we had some time on our hands so that we could discuss our cases, and from there it grew.
Yeah, it's been a remarkable experience, really, to do that. And we've done this now for, what is it, 3 years now, I think.
Yeah,
So yeah,
it's been really
incredible.
good. So BAPAM was the point at which we got to know each other, because we both do clinics for BAPAM, and you've done them for a lot longer than I have, as their go-to technique pedagogue for guitar. And I started doing clinics for BAPAM about 5 years ago. But when it came to lockdown, they put us both together in a great way, and we've been able to continue to collaborate since then. BAPAM, by the way, shout out to them, marvelous organization. This is their website, and they are a great signposting organization for help for musicians and performance arts people. So this was a model that I came up with after working in a sports clinic for a few years. I realized that basically the hand for a musician is an elite athlete organ, and it needs to be regarded like a sportsman's body, really. And in the sports clinic that I work in, this is what you can expect. If you're an elite tennis player, for example, then you'd expect a tennis doctor to be on hand for you. You'd expect a tennis physiotherapist that knows about the common injuries that happen in tennis, and your coach would be somebody who would know about the injuries that happen in tennis. That's a given, and all of them have an overlap of knowledge that goes on in the central part here, and there's some knowledge that the physician and the coach will share, and some knowledge that the coach and the physiotherapist will share, and the doctor and the physiotherapist will share. And then there's a small nugget of information in the middle of this Venn diagram. And around all of that, you've got psychology as well, and sports people expect that too. And so some patients just need me. So if they come to see me and they've got a broken wrist and they need me to fix it, I might just do that. But usually I'll need a hand therapist to help me with their rehabilitation afterwards. And they don't need to see a technique specialist at all in most cases. They get back to doing the technique just as they did before. But some patients will come to see me, and it's clear that they don't need an operation and they don't need a steroid injection, and that's something that often I do, and that they don't get to hand therapy or this. If they've got a trigger finger, for example, they'll just see me and go away, and they'll be happy, and they won't need anybody else's help. But there'll be some cases where it's clear to me that maybe some technique modification would be helpful. They might need a bit of hand therapy as well. And some patients that I see it'll become quickly obvious that what they really need is some psychological help, and we can provide that too. And BAPAM have amazing people to help in that regard too. So, but most often patients need a bit more of all of these things really, and we use them as needed. So how does this system work then? So basically I see patients in my clinic, and because Paul isn't a clinician and doesn't see primary patients, essentially he doesn't have students directly come to him, and then therefore, so he doesn't refer to me, I tend to refer to Paul. And if I, of the group of patients that I see that are guitarists, and within that, the subgroup of people who are in need of some technique pedagogy, I refer them on to Paul and pass on some information to him about the nature of the problem. We discuss it, and then Paul will see them. And in lockdown, we had the luxury of being able to see people together. I learned a bit about pedagogy and how he works. And then they may need some simple advice from him, or they may, and some patients don't need Paul's advice at all. So the conditions I see most commonly are mostly tendinitis in the form of trigger finger, tendinitis in the form of carpal tunnel, or other forms of tendinitis. And then after tendinitis, I see patients with other conditions. Guitar is the second commonest instrument that I see, and this is a count of the patients I see in my clinic, mostly pianists, and guitars closely followed by violinists. I don't actually know how many, what the denominator of this is, but this is the numerator of that equation. So basically, I don't know how many people in the country play piano, how many people play guitar, and how many people play violin, for example. And I'd like to find that out, and I'm setting out to try and discover that, to see which is the most disproportionately represented instrument in my clinic. It wouldn't surprise me if it was the guitar, which, as Paul will discuss later on, it's a brutal instrument. So, and these are the conditions I see. Carpal tunnel, I wanted to have a little look to see whether there were conditions that were associated with certain instruments. Carpal tunnel seems to be a little bit more common in pianists and guitarists than it is in violinists and cellists. And then arthritis, pretty evenly spread at around 7 or 8% across all instruments, and people who aren't instrument players at all. So that's not something that selects by instrument or being a musician. And similarly, the mention of tendinitis or tendon problems in my clinic is not strongly correlated with being a musician or any particular instrument. I do lots of things for people, treat them with steroids, hand therapy, surgery, general anesthetic and local anesthetic procedures, exercise things. If they do need to go on to Paul, then I'll continue to keep them under follow-up, and Paul will let me know how they've been getting on. So I'll hand over to you, Paul, and you can do the rest of the talk.
Thank you very much, Mark. Yes, and so this part of the talk is about the kind of problems that I see for the last 20 years and some of the things that you can do as a guitarist to overcome these problems. So what are some of the common problems? Well, some of the problems we see with the guitarist is that they're self-taught. And if they're just copying from other guitarists, they may not think critically about what they're seeing, because all guitarists are, of course, individuals and therefore different. And you cannot just copy somebody else's technique without maybe getting some problems. It's okay to do things already learning from YouTube and Facebook. I mean, I got a YouTube channel as well. But there is a problem if you're just copying again and learning something without thinking about the psychology behind actually playing the instrument, and also the physical aspect. So how do you hold and balance the instrument? Even people who come from many of the conservatories, some of those do not really offer courses in ergonomics or anatomy, which means that you as a guitarist maybe not really understand the functioning, for example, of your hand. The Alexandra technique can be extremely useful, but only if you take your instrument to the lessons. The other problem is maybe that you may have a really good guitar teacher, but as you know, if you've been on my YouTube channel, it actually helps that the teacher understands the ergonomics of the guitar, because as a student, you may just copy your teacher, and if your teacher is doing something that isn't quite correct, this could become a problem for you. Another thing that we see quite often is this thing that as a guitarist, we can become really obsessed with practicing. And that's not good, because if you're just practicing endless with many hours without actually having a break, that can lead to injury. The other thing is a thing that we have seen, both you and I, Mark, is that some guitarists will take a long time to seek help. even up to 10 years. And that means that the rehabilitation can be very difficult and actually take years because it involves relearning. And then finally, and this is a video also that you and I have made before, is the no pain, no gain culture. This is absolutely incorrect. You should not have any pain when you're playing the guitar. So please don't become an end gainer where all you are thinking about is result, but actually think about the journey. Well, how do I get there? Because that is actually more important than the results on its own. So what are some of the most common mistakes that I've seen? Well, the first one and the most important one is that the guitarist adopt the body to the instrument and not the instrument to the body. And you really need to learn that if you want to have a good guitar technique. Your body should be in a natural state and your instrument should be adapted to the body, not the other way around. We got something from the Alexander technique we call the primary control, which is the relationship between the head, neck, and the back. And this is really important when you're playing, that you understand how that works when you are playing and also when you are teaching, so that there is that freedom of movement between the head, the neck, and the back. A big problem is dropping the head forwards because the guitar is, of course, a visual instrument. It's absolutely fine to look at your hands when you're playing, but if you drop the head forward, you're creating a lot of tension, which is not a good idea. So just drop your eyes instead. A lack of warm up and cool down, that's really important. Anyone knows that when they're playing an instrument or doing a sport, so make sure that you do that, and you can find loads of exercises for that. The practice sessions are too long, not a great idea, because you're not really paying attention when you're practicing endlessly to your body feedback. So you can get really tired and get lots of pain. So mental awareness is decreased in those kind of situations, and we should avoid that. Before you start practicing, make sure you have a goal, so you know exactly what you're going to do and how you're going to achieve it. How do you measure progress? Well, if you don't know how to measure progress, then how do you know that your practice session actually was useful? And I'll come back to that in a sec. One of the problems on the guitar is that we have a lot of repetitive movements. And the danger of that is when you're practicing it, that you just do the same bars or scales over and over again, causing pain and fatigue. If your guitar is too big, you will have a problem because you'll be overreaching with your arms and hands, and that can create a lot of problems. So make sure that your guitar is the right size for your body. Another thing is, of course, that after you've been practicing, you might get onto your laptop and do other work. Well, that means, again, you're just sitting down. You need to get away from the instrument and walk around and maybe do some stretches. And finally, poor breathing technique. And I just advise you to look at my video on breathing technique on my YouTube channel. On the classical guitar, there are a number of things here that you need to look at. And I'm not going to go through all of this because you can just pause the video and look through these. But the overall idea is that actually you don't need your upper body. So let's say you're sitting down playing classical guitar, you don't really need your upper body to balance the guitar. You can actually balance the guitar between your legs. And I've got videos on my YouTube channel you can watch to see how that is done. And there are a couple of things in terms of the left hand, you know, that you need to really use your greater muscles from your shoulders and your back when you're using your left hand. So the hand that is fretting on the guitar. And for the right hand, if you come in on the guitar in the right position, then actually your right hand can be totally free from the shoulder and all the way down to the hand. It doesn't need to rest on the guitar body, because that can actually cause fixation and tension. So there are a couple of things there. And finally, I just don't use the rest stroke. I actually use the free stroke a lot because that's much better. So let's move on to the next slide. Electric guitar, very similar to classic guitar, but some of the things is that please don't be sitting practicing on your bed, whatever guitar you're playing. Your strap needs to be quite thick, so can it support you when you're holding the guitar over your shoulder. And the left hand, you know, be careful about what you do with the left hand, the one that, if that's the one that frets the guitar. You really need to relax it. And when you're bending strings on electric guitar, you need to relax the hand after that and then stop using the thumb. For the right hand, I often see people putting their little finger on the guitar body, which just means that you are in contraction and stuck on the guitar. It's not a good idea. Or hold the plectrum too tight, which there's no need to do. And there's some over rotation of the wrist and the wrist bending in much, which is not a good idea. And you really need to be careful with what picking technique you are using. That's very, very important. So here are some pictures that we can just look at. This is with the classic guitar. Classic guitar is sitting down, and you can see on the correct position of the guitar that the guitar is held between the legs. The upper body is not involved in it at all, which I think is a great idea. The incorrect position, you can see the guitarist is leaning forward, turning the body, sort of twisting the body like that over the guitar, and therefore for prolonged use will cause quite a lot of pain. look at the left hand here, you can see that this is a much more relaxed position. Notice that the wrist is as straight as it can be, and that's much better position for the left hand on a classical guitar. And now you can see just the opposite. You can see how you've got issues with bending the wrist here, and again with the thumb coming up over the neck, which is not a good idea. These two types of positions are positions that I would suggest you avoid using. Right hand technique, you can see now the right hand's coming in straight on the guitar. The wrist is as straight as it can be on the picture. This is correct. And incorrect, you can see how there is a tilt of the hand towards the right, away from the guitar, and that can cause a lot of pain in your wrist. So here we've got the electric guitar, and you can see here again, I'm using the same type of technique, coming in with a very relaxed and straight wrist straight onto the guitar. And the incorrect one, where I'm actually putting the little finger down on the guitar as a support mechanism, and you can see there how far away my right hand actually is from the guitar strings, and that's not a good idea. And so we got here a right hand technique for electric guitar, and you can see it's very relaxed. It's okay that the thumb comes up over the neck. That's absolutely fine, as long as you don't bend it constantly. Again, a very nice wrist there. And the incorrect one, notice that bend there. That's really unhelpful. You can compare the two to each other and see the difference. So what can you do? Well, you need to learn to breathe. I talked about watching that video before. You can do that. Think about a holistic approach to your playing, and be really aware of what you are doing with your body when you are playing. Very short practice sessions, absolutely 5 minutes, take a break, think about what you've done, get away from the guitar and come back. Visualization is fantastic. I have a whole video on how you visualize to learn your music without using the instrument, and I really encourage you to check that out. Shadow practicing, you can play on the instrument, but actually without putting pressure on the fretboard. So you are practicing your music, but you're using very little muscular activity. Delayed continuity, again, check this video out, but it's basically a way of learning to play by measuring your progress. And I'm not going to go into the details about delay continuity in this video, but check it out on my YouTube channel. It's a phenomenal way of learning to play anything really fast, but in a very short amount of time. So as we talked about before, drop the eyes, but don't drop your head when you're looking at the fretboard to avoid tension in the neck. And only use the muscle group that you really need for playing. So think about, how much pressure do I actually need to put on the guitar when I'm playing with my hand and my fingers and my arm and shoulder and so on. The peripheral view is one of the greatest things, because you can actually look straight out, say at the audience, but you can actually see what you're doing with your left hand from your peripheral view. And what it does, it takes tension away, so there's less tension in your head, your neck, and your back. So here are some ideas of strategies that you can apply to get a better technique.
Marvelous, really good stuff there, Paul. Thank you for that. It's always a pleasure working with you. So these are the resources then that we've got on our respective websites. There's loads of content online under the blog section. I'll be putting this up there as well. And you've got your own website, 2 websites actually.
Yeah, and YouTube channel.
Yeah, with the YouTube channel. Yeah, and then you've got BAPAM and the Royal Society of Musicians and Help Musicians, really useful organisation too for resources. BAPAM, great place to be signposted to further help. If you need to be seen, you can contact BAPAM and they will offer you an appointment if you're a musician.
Yeah, and I think the best advice I think we can give to guitarists who are watching this is, come early rather than late if you need help, because there's a much higher, I think, chance for success and much less relearning to do if you come early with your problem instead of waiting.
Absolutely. Right, well, we'll finish it here then, Paul, and we'll do more in the future.
Absolutely. Great to see you, Mark.
Good to see you.